So, today we'll be going over a simple primary care review on schizophrenia. DSM 5 Diagnostic Criteria. A. Two or more of the characteristic symptoms below are present for a significant portion of time during a 1 month period or less if successfully treated. 1. Delusions. 2. Hallucinations. 3. Disorganized speech, which are frequent derailment or incoherence. 4. Grossly disorganized or catatonic behavior. Or 5. Negative symptoms, affective flattening, alogia, and avolition. B. For a significant portion of time since the onset of the disturbance, one or more major areas of functioning, such as work, interpersonal relations, or self care, are markedly below the level achieved prior to the onset. C. Continuous signs of the disturbance persist for at least 6 months. The 6 month period must include at least 1 month of symptoms or less if successfully treated that meet criterion A, which is the active phase symptoms, and may include periods of prodromal or residual symptoms. During these prodromal or residual periods, the signs of the disturbance may be manifested by only negative symptoms or two or more symptoms listed in criterion A that present in an attenuated form, which are odd beliefs or unusual perceptual experiences. Schizoaffective disorder and mood disorder with psychotic features have been ruled out because either 1. No major depressive, manic, or mixed episodes have occurred concurrently with the active phase symptoms, or 2. If mood episodes have occurred during active phase symptoms, their total duration has been brief relative to the duration of the active and residual periods. E. The disturbance is not due to the direct physiological effects of a substance. Example is a drug of abuse or medication, or a general medical condition. F. If the patient has a history of autistic disorder or another pervasive developmental disorder, the additional diagnosis of schizophrenia is made only if prominent delusions or hallucinations are also present for at least a month, or less if successfully treated. Clinical manifestations. Schizophrenia is a syndrome. People with schizophrenia generally present with several symptom domains: positive symptoms, negative symptoms, cognitive impairment, and mood and anxiety symptoms. Positive symptoms. This group of symptoms include the reality distortion symptoms of hallucinations and delusions, as well as disorganized thoughts and behavior. Hallucinations are defined as the perception of a sensory process in the absence of an external source. They can be auditory, visual, somatic, olfactory, or gustatory. Auditory hallucinations are the most common form of hallucination, with prevalence estimates between 40 and 80% in people with schizophrenia. Delusions, defined as a fixed false belief, are present in approximately 80% of people with schizophrenia. Bizarre delusions are clearly implausible, which is they have no possibility of being true. For example, they contradict the laws of physics. An example of a bizarre delusion is that the belief that aliens have cloned a perfect body for the patient, but he must find a way to take off his head so that his spirit can flow into the new body. A non bizarre delusion is one that, while not true, is understandable and has the possibility of being true. And an example is that the IRS is after the patient for not paying taxes. Ideas / delusions of reference are beliefs that random or neutral events are not random or neutral, but include the individual in a special way. Common ideas of reference include believing that occurrences on the television or radio, certain words said or songs played, are meant to deliver a special message to the individual. Grandiose delusions form around the belief that the person has some special significance or power. Paranoid delusions are clinically important because they may increase the likelihood of problems such as homelessness as the person goes off the grid. Disorganization. Schizophrenia is a thought disorder. People with schizophrenia typically display some disorganization in behavior and or thinking. Disorganized behaviors are directly observed, while disorganized thoughts must be inferred from the speech of the person. Tangential speech. The person gets increasingly further off the topic without appropriately answering the question. Circumstantial speech. The person will eventually answer a question, but in a markedly roundabout manner. Derailment. The person suddenly switches topic without any logic or segue. Neologisms. The creation of new idiosyncratic words. And lastly, word salad, which are words thrown together without any sensible meaning. Negative symptoms. Negative symptoms are conceptualized as an absence or diminution of normal processes. Negative symptoms may be primary or secondary. Examples of negative symptoms include decreased expressiveness, apathy, flat affect, and a lack of energy. Primary negative symptoms are very resistant to treatment and closely related to functional outcome. Deficit schizophrenia. While not a recognized DSM 5 subtype of schizophrenia, people with schizophrenia who have prominent negative or deficit symptoms as a primary manifestation of the illness appear to represent a distinct subgroup. People with deficit schizophrenia are less likely to have delusions with high emotional content. People categorized as deficit are least likely to show improvement and recovery over the course of the illness. Cognitive impairment. This includes processing speed, attention, working memory, verbal learning and memory, visual learning and memory, reasoning / executive functioning, verbal comprehension, and social cognition. Physical manifestations. There are several physical manifestations associated with schizophrenia, including neurological disturbances, catatonia, and metabolic disturbances. Examples of neurological soft signs are right left confusion, agraphesthesia, the inability to recognize letters or numbers traced on the skin, usually on the palm of the hand, and astereonosia, the inability to identify familiar objects by touch alone. Catatonia can present in schizophrenia as either extreme negativism or mutism, or catatonic excitement. Metabolic disturbances include hyperlipidemia and hyperglycemia. Management, early intervention, and multidisciplinary treatment. Timely, intensive treatment can positively impact psychosocial functioning early in the illness. Suicide. The rate of suicide among people with schizophrenia is much higher than in the general population. However, treatment can decrease the risk of suicide. Thank you.